Assalamu alaikum. Today we will discuss about the membranous nephropathy. Membranous nephropathy, it is the most common cause of nephrotic syndrome in adults. It is a rare cause of nephrotic syndrome in children. Membranous nephropathy is classified as number 1 primary, number 2 idiopathic form, number 3 isolated renal disease or secondary membranous nephropathy. In children, secondary membranous nephropathy is more common than primary idiopathic membranous nephropathy. Etiologies of secondary membranous nephropathy: systemic lupus erythematosus, hepatitis B, congenital syphilis, malaria, penicillamine, gold, and chronic factor replacement in patient with hemophilia. And number 8, neuroblastoma is rare. Pathophysiology of pathologies: immunofluorescence and electron microscopy demonstrate granular deposits of IgG and C3 on epithelial side of the glomerular basement membrane. Now we come on the clinical manifestations. Most common clinical manifestation is in second decade of life, but it can occur any age including infancy. It manifests nephrotic syndrome for 2 to 6% of childhood. Most patients have microscopic hematuria, rarely gross hematuria. 20 to 30% of children have hypertension at presentation. Renal vein thrombosis, complication of membranous nephropathy. C3 level are normal except SLE. Diagnosis on clinical grounds: renal biopsy. An indication for renal biopsy: nephrotic syndrome in child greater than 10 years, unexplained persistent hematuria with significant proteinuria. Treatment: immunosuppressive therapy with extended course of prednisone can be effective. Addition: chlorambucil, cyclophosphamide, and rituximab. Further benefit to those not responding to steroid alone. Angiotensin converting enzyme inhibitors, angiotensin receptor blockers. Prognosis: asymptomatic low-grade proteinuria remission spontaneously. Poor prognostic factor: number 1, male gender; number 2, high level of proteinuria; number 3, reduced kidney function; number 4, finding of glomerular sclerosis and tubular damage in renal biopsy. So this is all about the membranous nephropathy. Thank you.